behavioral health hospital in Orange County, and one of the biggest advocates for many years in Southern California for that population. And it's great to see that in the 8 to 10 years or so since I left the C-suite, there is so much support now coming from the states and at the federal level for behavioral health. Have you found, with most of your hospitals being in the Western region, have you found the states being more receptive to the goals of your ministry and stepping to the table, whether at the county or state level, to support those efforts as well?
Yeah, and I didn't mention I've been with Providence for 22 years in the C-suite. So I was here when it was pretty small, now what it is today. And one of the things that we've done, again, to be this community catalyst is we've not only looked at how do we work with the homelessness and how do we solve that problem. We've also done the same thing in really deep segmentation of the mental health issues in each of our communities, and also have done the same thing with the Medicaid and Medi-Cal populations. And obviously there's linkage between all three of them. But just to give you a great example of the level of receptivity, there's a program here in Orange County called Mind OC. And Mind OC actually was an idea that came up through a group of people at Providence, some folks at Hoag. And the idea was we went out and talked to primary care docs, we went out and we talked to ER docs, et cetera. And there really was no triage system in Orange County that would give people a place to go for a period of time to be able to deal with the mental health issues. And so we're creating what's Mind OC. And the first project that's coming out of the ground is in Santa Ana. It's a 60 room unit. And it's how it was funded was, one, the city of Santa Ana donated the land and building. Two, the largest health plan here, Cal Optima, put in $12 million as an example. And we've had multiple other components of the government put money in. And so we found it incredibly receptive. And that's just one example. I can give you another great example. Alaska Cares in Anchorage, Alaska, where they have significant mental health issues related to child abuse. We built a system there that really helps that population. And again, we were the catalyst to get it off the ground, but we have multiple supporters at both the state, federal, and local level. And I think what Providence has tried to do really well is make people aware of the issues of mental health, and I think it's our whole country is getting to this point too. It's no longer a stigma. It's something to deal with. It's one of the challenges in our society, and how do we take better care of it? The other thing that's beginning to be exciting is more and more people are getting engaged from a private philanthropic perspective. They're saying, hey, I've been through this with my family. This organization is really trying to make a difference. I want to be involved and be part of that cause.